Accidents happen regardless of time and place at home, school, and anywhere. What is first aid? First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. First aid is an important tool in quickly responding to accidents to ensure that injuries can efficiently and promptly dealt with before a trained medical professional arrives to administer more specialized treatment.
Why do we need to possess a first aid knowledge? First aid is an emergency care given immediately to an injured person. The purpose of first aid is to minimize injury and future disability. In serious cases, first aid may be necessary to keep the victim alive. So, there are 5 main aims to first aid, and these are: first, to preserve life; second, prevent the escalation of the illness or the injury; third, to promote recovery; fourth, pain relief; and lastly, is to protect the unconscious. There are 5 reasons why basic first aid knowledge is important. First, it does more than help to save lives. Second, it enables you to increase patient comfort. Third, it gives you tools to prevent the situation from becoming worse. Fourth, it creates the confidence to care. And lastly, it encourages healthy and safe living.
The basic first aid kit. A basic first aid kit should include alcohol pads or antiseptic pads, band-aids, cotton balls and Q-tips, elastic bandages, hot and cold packs, medical tape, small container of sterile water or saline spray, soap and hand sanitizer, sterile gloves, rolling pads, triangular bandages, and CPR mask with one-way pump. And here are the over-the-counter medications: the acetaminophen, aloe, antibiotic ointment, calamine lotion, hydrocortisone cream, ibuprofen, sunscreen with a SPF of 30 or higher, and the other supplies: the emergency blanket, flashlight and extra batteries, insect repellent with 10% of or less SPF, matches and candles, paper and pencil, safety pins, sharp scissors, splitting material, thermometer, tweezers, bottle of drinking water, basic pocket knife or first aid manual, and other items specific to the activity or destination.
Examples of injuries and accidents: cuts and scrapes, nosebleed, burns, sprain or strain, epilepsy, dog bite, and choking. Tips on how to apply first aid. First, we have the cuts and scrapes. Wash your hands. First, wash up with soap and water so you don't get bacteria into the cut and cause an infection. If you are on the go, use hand sanitizer. Stop the bleeding. Put pressure on the cut with gauze pad or clean cloth. Keep the pressure on for a few minutes. Clean the wound. Once you stop the bleeding, rinse the cut under cool running water or use saline wound wash. Clean the area around the wound with soap and wet washcloth. Don't get the soap into the cut because it can irritate the skin. And don't use hydrogen peroxide or iodine, which could irritate the cut. Remove any dirt or debris. Use a pair of tweezers. Clean with alcohol to gently pick out any dirt, gravel, grass, or other material in the cut. Nosebleed. Nosebleed usually look like worse than they are. Most of the time, you can stop the flow with a few simple steps. Lean the head slightly forward so blood doesn't run down to the throat. With a tissue or washcloth, gently press the nostrils together to stop the bleeding. Hold the nose for at least 5 minutes, then check to see if the bleeding has stopped. If it hasn't stopped, gently squeeze for another 10 minutes or call the doctor to go on the emergency room if the bleeding hasn't stopped after 15 to 20 minutes or keeps starting again. The bleeding is fast if there's a lot of blood. The bleeding is from an injury to your nose or face. You feel faint or weak. Minor burns. You can treat minor first degree and small second degree burns at home. Here's what to do. Place the burned area under running cool water for at least 5 minutes to reduce swelling. Apply antiseptic spray, antibiotic ointment, or aloe vera cream to soothe the area. Loosely wrap a gauze bandage around the burn. To relieve pain, take ibuprofen or naproxen. Never put butter or a burn or pop any blisters that form. You could damage the skin that can cause an infection. Sprain or strain. Rest the limb to give it a chance to heal. Hold an ice on the area for 20 minutes at a time, 8 to 4 times a day. To bring down the swelling, don't use heat. It could make the area swell even more. Wrap an elastic bandage or split around the area of the sprain or strain. Put a pillow under the injured body part to keep it raised. Take over-the-counter medicines such as ibuprofen to relieve the pain. For a more severe sprain or strain, where there's a lot of pain, swelling, and you have trouble moving around, see your doctor. You may need crutches or physical therapy.
What you are gonna do to the dog? First, don't kill the dog. Second, observe the dog. And lastly, a rabid dog usually dies within 14 days. The things that we should not do with dog bites are the following. First, application of garlic and vinegar directly on the bite wounds is another method that physicians discourage. Second, putting garlic and vinegar on the wound may only cause more complications such as swelling or irritation.
Basic things to avoid when giving a patient a first aid. Cuts and scrapes. Don't. Contrary to last century's popular wisdom, do not apply a tourniquet or tie the injured limb to stem bleeding. You will cut off circulation, doing more damage. Do. Wash the wound with distilled water. Minor cuts and scrapes usually stop bleeding on their own, so swab with antiseptic and wait. If that's not enough, apply gentle pressure with a clean cloth or bandage and hold it in place for 20 to 30 minutes. Nosebleeds. Don't. Leaning back can be harmful. The blood will get into the windpipe, blocking the airway. Do. Sit in a comfortable upright position and lean forward slightly, then pinch your nose just below the bony bridge and above the fleshy lobes of the nostrils until the bleeding is stemmed. Might help ice packs applied around the nose and on the forehead. Burns. Don't. Never put ice on the burn. It will delay healing or cause extra damage or thin frostbite. Also, leave the butter in the kitchen unless you want to make it worse. After care, cover the burn with a loose bandage or clean wash cotton sheet for a larger area and go to the doctor. Twisted knee or sprained ankle. Don't. Exercising it will not make it go away nor lessen the swelling. Do. Remember the acronym RICE. R for rest the injured area. I for ice it for 20 minutes at a time or at 20 to 40 minute intervals for the first 24 hours. C for compress lightly with a bandage if you have managed to treat it before the swelling has developed. And E to elevate it over the level of the heart if possible to minimize swelling. Choking. Don't. It is everyone's first instinct, but don't slap someone who is choking on the back. You could force the offending object further down the windpipe. Let the person cough and don't rush to offer water. Do. Coughing forcefully is usually the best way to dislodge a piece of food. If that is not helping or the person seems unable to cough or draw breath, stand behind the person and deliver 5 sharp blows between the shoulder blades with the heel of your hand. Check the mouth quickly after each blow and remove any obvious obstruction. Meanwhile, call a doctor. If the obstruction is still present, try up to 5 abdominal thrusts. This is known as the hind leg maneuver. Place a clenched fist above the navel and pull inwards and upwards.